Thank you so much. Hi, everyone. I see that folks are joining. We're very glad to have you here today. We are launching our new National Ombudsman Reporting System training course. And so we're going to talk a bit about that today. But first, I want to go over some housekeeping and then some introductions. So if you are familiar with our webinars, we do record all of our webinars and we email out the link to our entire network and to everyone that registered, and it'll be on our website. This is a webinar, not a Zoom meeting, so please use the Q&A feature for questions for our speakers today, and we will get to those questions at the end of all the presentations. Feel free to use the chat feature to submit comments or respond to questions from speakers or other attendees. And please complete the evaluation questionnaire when the webinar is over. As soon as the webinar ends, the link for the evaluation questionnaire will pop up. So please complete that for us. It's really, really important. And links to the slides will be available in the chat. I believe it's already been dropped in. Thank you so much. And we will email, Katie and I were talking before the webinar today. We're going to send an email blast to everyone with all the new resources and links to the recording as well. So you will have this information available and you can review it in the future. So as you likely know, since you're joining us today, the National Ombudsman Reporting System, or NORS, is the uniform data collection and reporting system required for use by all state ombudsman programs. ACL created and has updated the NORS data elements, and ACL provides technical assistance to state ombudsmen for their annual reporting. And as an ACL-funded resource center, NORC develops training materials and provides technical assistance to state ombudsmen and their statewide networks of representatives. With a really big thank you to the Administration for Community Living, or ACL, for funding this project, we are very happy to share that we've created this new NORS training tool, an online course. We provided a preview of this course for state ombudsmen at the end of June to give them time to start thinking about if and how they will use this course in your state. Today, we wanted to share the course with you and also introduce some additional training materials, both revised and new. Today's webinar will start with some remarks from Beverly Laubert. She is the National Ombudsman Program Coordinator with ACL. And then I'll review the NORS modifications and provide a very high-level overview of our materials. And then Maria Green, which you're likely very familiar with Maria. She's a fantastic consultant that we've worked with closely for years, especially in our NORS work. And she'll provide a more in-depth look at the new and revised materials. And then Katie O'Hearn, she's our Manager of Program and Outreach with NORC, will share her screen and show you the online course. And like I said before, we will have time for questions at the end of the presentation, so please put those in the Q&A box. And now I'd like to turn it over to Bev.
Hello, everyone. So glad to be here today. Thanks to Amity and the NORC staff for being such good stewards of our federal funding and creating resources that are dense and useful for ombudsman representatives. We really appreciate the work that you do because we could not do this on our own. This course includes an introductory video from me, so I won't take much time now, but wanted to reiterate a couple of things that NORS was developed. So we have a database of information to tell the stories of long-term care resident experience. NORS is the only data collection that describes conditions in long-term care from the resident's perspective. So your documentation is really important. The data is used by state ombudsmen to inform systems advocacy and identify trends. At ACL, we use the data, case examples, and system issue narratives to inform members of Congress and other federal agencies about long-term care issues, and ultimately demonstrate the value of your work as advocates. Amity is going to go over changes that we made to the NORS instructions. When we posted the tables for comments, we received requests to add complaint types and even a whole new category of complaints, but we didn't do that because it's not time to add burden to your programs. Adding codes would require revisions to state data systems, which can be very expensive. So we chose to make adjustments to instructions and guidance that should help with some of the comments that we received. The Resource Center meticulously developed the NORS course and materials to align with our federal requirements. And I reviewed everything before the launch, but I will tell you, after 37 years working in the Ombudsman program, I missed a couple of the quiz questions. So even if you're an experienced Ombudsman, it's important to go through the course. It makes you think and provides great reminders of good practice. So with that, I'll turn it back to Amity to go over some of the revisions.
Thank you, Bev. And you are not alone in missing some of the quiz questions. In fact, some after we launched with state ombudsman, I know they shared it with their state staff, and we had questions about the quiz questions and answers. And some of our technical assistance back was, well, that answer actually hasn't changed. It's been the same one used for the training materials for years. So definitely use all of these materials as a refresher. But as Bev mentioned, the NORS tables were slightly modified based on input received from stakeholders, so state ombudsman, program representatives, and related associations during an open comment period. This round of modifications were minor, but the changes do provide more clarification that'll help with your reporting, and some of the changes will impact your reporting. So we wanted to revise and launch these training materials a few months before the next federal fiscal year, which starts October 1, to provide states time for training on these modifications. So the first one is on table 1 about complaint disposition. There were questions over time about how to determine disposition when a resident passes away before final outcome, and they do not have a resident representative. So this modification passes away before the final outcome has been attained, and they have to determine resolution. Table 2, which you may be familiar with, has all the complaint codes, definitions, examples, and reporting tips. There were a few updates to that. For F01, accidents and falls, the revised, the examples and reporting tips were revised to make it more person-centered language. So instead of the previous language, it now says a resident who uses a wheelchair independently. So that doesn't change how you report it, but it is more person-centered. And the second one was I01 for environment. It was revised definition as well as revisions in the examples and reporting tips to add a little bit more clarification of what could be included in environmental concerns. And so as you can see in the bold for the definition, the building environment, including safety hazards, that was added. And then for the examples and reporting tips, you can use this code for cigarette smoke or other odors, noise, hazards such as cleaning supplies improperly stored. So that will hopefully provide you with some clarification about how you can use that code. For table 3, there were 4 changes. Some of this doesn't impact your reporting if you are a program representative. A lot of this data in table 3 is actually pulled out from your state data collection system by the state ombudsman and reported annually in their NORS report. But just wanted to let you know that for staff and volunteer data, the element description was revised, and now volunteer counts include volunteers who were program representatives at any time during the federal fiscal year. Previously, it was the count for volunteers had to be as of September 30th, so who was currently active as a volunteer on September 30th, which obviously didn't count several volunteers that may have volunteered throughout the year and contributed to the program and contributed hours to the program, but weren't counted on that day. So resident council participation and family council participation, the definitions were also revised, basically to expand and clarify what counts for council participation. It added or resident groups or family groups, basically because we did receive some questions, technical assistance questions about I provided training to a group of residents. It wasn't during a formal resident council meeting. How can I count that? Well, for residents that live in that facility, all residents are naturally considered part of the council, whether they attend a council meeting or not, just because they are residents of that facility. And so resident groups and family groups were added to that so you could get that, count that as council participation when you're providing training to those groups. And community education, this is another one that I definitely wanted to call your attention to because it is different than the previous version in the NORS table, but the examples and reporting tips were revised, allowing newsletters and other forms of media that share information about long-term care or the Ombudsman program may be counted as community education. Previously, that was not allowed. So that will impact your reporting. So for NORS, for reporting consistency across the country, NORS provides definitions for activities such as cases, complaints, complaint codes, and describes how to count activities, visits, training, and whatnot. State program policies and procedures establish program practices, such as what is a quality visit, and program standards also define the frequency of visits that you're required to do in your state, how to document those visits in your state data system, because many states have different systems. And they also provide timeframes for responding to complaints as well as requirements for getting your documentation into the system. But I want to be clear that our NORS training developed at the Resource Center and shared today only focuses on NORS requirements, not state practices. However, we can and we do provide technical assistance to states about successful practices for ombudsman activities and advocacy. So just wanted that clarification for whenever you're looking at these resources. So for our training materials, as Bev mentioned, the written and online NORS trainings have been reviewed for consistency, are based on the revised ACL NORS tables. ACL's reviewed them, and we did a pilot study as well. The codes, definitions, examples, and reporting tips are all from the tables. So if you have a question about why it's worded a certain way, it's because that was literally lifted from the NORS tables. If you're familiar with our NORC initial certification training, and you've used that online platform for those courses, just to let you know, the NORS course was developed in the same platform, and so it should look really familiar to you. The online course is free and it can be accessed anytime. And speaking of that pilot project, ACL, Bev was involved in that review. So thank you, Bev. But of course, we had some reviewers from Arizona, Colorado, Illinois, Iowa, and South Dakota, both state ombudsmen and program representatives. And we really appreciate that feedback. If you're familiar with those, they have the basic principle documents and then the quizzes with answers and the NORS frequently asked questions. Our NORS webpage includes the modified ACL NORS tables as well, so it's all in one place. The new materials include a side-by-side chart highlighting the NORS tables modifications, as well as 2 decision trees that we created in response to technical assistance that we were asked about often. So next, Maria will walk through these briefly with you, and then Katie will give us a tour of the online course. And afterwards, we will have time for those questions, so continue to put those in the Q&A. So Maria, you're up.
Thank you, Amity. Just as a reminder to everyone, you see the address for the longtermcareombudsman.org site. That's an important one. You may also want to refresh it in order to see all the updates that are there. So see the big red arrow here on the left-hand side is pointing to the National Ombudsman Reporting System. That's what you will click to see all the written documentation that is displayed on the right-hand side. So see here where we have the legend on the left-hand side, it's bolded in blue, and then there are the things listed underneath that you'll be able to find. Katie's going to talk about the online training that you see listed here on the left-hand side, but I just want to go through really quickly the materials that you will see both online, but also, as always, it's available on the National Ombudsman Resource Center site. And this is what the NORS training parts 1 through 4 look like when you open up the page on the website. You can click those. So open it up. You can print it if you want. Some people still love to have, I'm one of them, like to have paper. So if you like to have paper, plus you want to see it online, you can go and access it there. Next slide. Amity has mentioned a couple of times that a lot of our changes and updates are made because when you call for technical assistance, when we have more than one, sometimes it's the same topic, we go through and we update those frequently asked questions. So the first 3 that you see here, we updated them based on the fact that the guidance was modified in the tables. And Amity mentioned those a while ago, such as counting the newsletters as community education, and also the disposition code for if a resident dies during the investigation. And then the 4th one I want to point out is a brand new one. So if you're ever you're searching for TA, check the site, please, because we already may have answers or options for you to consider here on the NORS FAQs. So the 4th one is, how do I document the receipt of notifications of facility closure? I won't go through that today, but just want to highlight that for you to know that it's there. Okay. The next slide is a brief look at how those modified ACL tables look. If you look really closely, the small font, you'll see that the layout is just exactly the same. Okay, so it should be easy for you to read and familiarize yourself with it. If you would like to have a chart showing all the revisions made to those tables 1, 2, and 3, on the next slide, you'll see the work that Katie and Amity did to give you this revisions chart. So it's a quick look at what changed, where, that sort of thing. For those of you who might be responsible for doing training for your representatives in the state or in the regional offices, this resource may be of big help to you. We hope. Also, we have some more resources to show you. So this one is this a complaint or is it information and assistance? We get this question all the time. We're hoping that the new decision tree on the right-hand side there that you see is going to be really helpful for you and also for new representatives who are challenged and trying to figure out, hey, is this a complaint or am I providing information and assistance? So with this chart, I'm looking at the flow chart on the right-hand side. Basically, the basic question is, does the individual have a concern? Concern being like a complaint, they're having a problem in the care, for their care in the facility. If the answer is no, they do not have a concern, then more than likely you are providing them some sort of information and assistance. They're asking you for a referral list of facilities. They're wanting to know how to call another agency, something that you're going to respond to them by phone, maybe by email. You're going to document that in your data system as information and assistance. Look at the decision tree on the left-hand side. Does the individual have a concern? Yes, they do. And then there's options for the trees. Yes, they have it. Oh, I need to put my glasses on. Excuse me. Yes, they have a concern and they want your assistance. So that at that point, it becomes a complaint and you have a complainant, and therefore you're going to work to resolve this case. If they talk to you about a concern and they said, no, they really don't want your help, all they needed was some information about how to pursue it themselves, then that is not a complaint. You wouldn't open up a case. It would become an instance of information and assistance. I know I went through that very quickly, but you're also going to have many opportunities to see this checklist, both available on the NORC site and with the online NORS curriculum, and you can look at it a lot closer. Thank you. And we've got another one. You ask and we deliver. Is it a visit? Hey, are you in a long-term care facility? Look on the left-hand side. Then yes, it is a visit. You're going to count it as a visit. So here's all the things that you could be doing while you're doing a visit in the block down below, and you'll see the bullet points there. Maybe you're participating in that resident family group discussion. Maybe you're doing a training with staff. Maybe you're doing a complaint investigation. All of those there are activities that you would be conducting while you're doing a visit. You may also have specific guidance from your state ombudsman office that is above and beyond what NORS has requested to be recorded. So always check in with your state ombudsman office. Okay, look on the left-hand side. Are you in a long-term care facility? No, you're not. You're in your office. Maybe you're in your home office. This is not a visit. If you're not inside a nursing home, if you're not inside a residential care community, it's not a visit. More than likely, you're providing an instance of information and assistance. You're giving them some information. You're providing all these other activities that are listed here on the chart. So we hope these are helpful. Okay, on the next slide. This isn't something this is not on the NORS online, but we thought it would be really helpful. We updated this resource to make it available and consistent with what we've got in the NORS training and the NORS online curriculum, which is one and the same. But we went for consistency, right? So these quality visit guides are available for you as a resource. You can download one. They're there for that. If you feel it would be helpful for your office, your program, to have copies of these pocket guides, you can look into purchasing copies of those through the Consumer Voice website. Okay. And I think we're to my next slide, which is just some general tips. These, I'm just wanting to reiterate what Bev and Amity have said, is that the state ombudsman's office is going to be the one in your state to decide, is this going to be the state's sole NORS training source? Maybe it is. Maybe your state says, well, we've got more information we want you to collect as a part of your state's data system. And your state ombudsman office is going to be providing the information on those policies and procedures and how to document it. Your state ombudsman office will also decide if all of this can count as an annual continuing education. We think it would be a benefit, just as you've heard of us acknowledge that even going through this, we maybe got an answer incorrect. So hopefully it can be a part of your annual continuing education. And for those of you who are regional representatives, program managers, for instance, if you have a representative who you feel like needs a refresher, you can go into this online course and just do a particular module. You don't have to do the entire course, and Katie can point that out for you. Just one last word I want to share, because we hear it often, is a representative may say to us, I'm in such and such state, and my friend over in the adjoining state, they don't have to report XYZ. Okay, that's true. But more than likely, whatever you're reporting and they're not reporting in the adjoining state is something that your state ombudsman office has asked to be collected for your state for valid reasons. Maybe they need to show that in a report to the policymakers in your state. So thank you for the opportunity to talk with you today and participate in this project. I think Katie is next.
Hi, everyone. So I'm going to walk you through how to access the training materials and the online NORS course, how to take quizzes, how to receive your certificate, and provide a sneak peek of what the course looks like. So while I talk, I'll just share some general information about the training that's also listed on this slide for you. So if it's all right, I'm going to take control and share my screen. Okay, so as Maria said, you access the training by going to ltcombudsman.org. So that's the URL to our website. And then hover over support and then click NORS. So this is where all of the NORS training materials live. So this is where the tables are, the complaint code, resources, and then this is how you access the online courses by clicking here. But if you just scroll down a little bit further, this is where all the written material is that matches the online course. And then we have FAQs and the NORS data underneath. So I'm going to go into the online training by clicking the green button. And I'm already logged in because I already have an account. But if you don't have an account, it will take you to a login page and you'll set up your account and then you'll receive a confirmation email once your account's created. And then once you log in, it will look something like this. So to see all of the courses, you would click Course Catalog over here on the left. And so this is all of the courses that NORC has created. So you'll see there's multiple pages, so you can view all of them. So these 4 are the NORS courses, and then the other 10 are part of the initial certification training. So you can click on one category. So if you just want to see the NORS courses, you would click this button, and all 4 of them are here. So as Maria said, you can take just one course at a time. You don't have to take all 4. You can pick and choose whatever your state ombudsman tells you to take. And then you can also change how they're sorted. So if they're not in order, you would just click this button here, and you can, sometimes it automatically sorts by date, which puts them out of order. This is just the date that they were added to the platform. So if they're out of order, you would click name, and then they'll be in order. And so you can see that I've already taken part 1. So it says I've taken this course. So we're just going to pop into part 2 and see what it looks like. So I've never been in part 2 before. So this is what it'll look like. And then you will click get this course. So you're self-enrolling yourself into the course. And then you would click start. And so as it loads, it looks pretty skinny over here. So you can expand it by clicking this hamburger button, and it will make it go full screen. So this is the landing page for part 2. And so if you scroll down, you'll see the intro and then all the different sections that are part of part 2. So you can click welcome to start, and then you'll see your progress on the left over here. And the course has lots of images and written text and interactive things like flashcards and videos. And in the welcome, you'll see there's tips for navigation, and we did as much accessibility as possible. So there's captions on the videos, and then if you click accessibility tips, there's information on how to use your keyboard and screen reader navigation if needed. So I'll just keep scrolling through. So as you take the course, you'll read and then just keep clicking continue. So you'll see I'm now in section 2. And so this is a video. I won't play this whole thing, but you'll see that there's captions here. And then if you scroll down, you can see the whole script here. So I'm going to skip down to the quiz here. So each part has its own quiz and its own certificate. So there will be 4 certificates, and your state ombudsman can log in to their own account and see reports on your progress and your quiz results. And they can also see how long it's taken you in the course and to take the quiz. So just wanted to let you know that that's visible to them. But once you complete the course quiz at the end, you'll receive a certificate, but you have to receive an 80% or higher on the quiz to get the certificate. And if you do that, you will be able to immediately download the certificate and it will be emailed to you. And then I'll also show you how to get to it in the platform. So if you click this hamburger button, you can click back and it'll take you back to the platform. So now I'm in my courses. So these are all the courses that I've taken. And so you can take a course at any time. You can start it and then finish it at any time and you won't lose your spot. And then once you finish a course, you can click on your name and then go to My Progress. And then you'll see that there's a certificates tab. So you'll see I've received a certificate in NORS Part 1, and I can download it here or I can preview it. If you ever delete the email, it's always stored in the platform here for you. Okay. So like I said, you can go to My Courses to see ones you've started and finished, and then the course catalog has all of the courses in one place. And you can categorize them by clicking the buttons here. So we suggest once you complete a course and you receive your certificate to let your supervisor know. You can email them the certificate, but I do want to mention that receiving a certificate does not mean that you're certified. Your state ombudsman will provide policies around taking the course. So you must complete all certification requirements and be designated by your state ombudsman to perform duties as a representative. So they will let you know their policies, and receiving a certificate does not necessarily mean you've completed your state ombudsman's requirements. So that is all I wanted to show for now. So thank you.
Thank you, Katie. Just one second. Let me share my screen again. All right. So it took me a little while to unmute and turn my camera back on because I was already looking ahead at the questions. So we received some questions in the Q&A box and a couple in the chat that I wrote down to try not to lose them. And some of these I may punt to Bev to get her feedback first before I respond. And I also want to be really clear too that if there's something that we don't have an answer to right now, we're just going to say that. And then Bev, I'll talk to Bev, offline, and we'll come up with something, and we'll maybe create a new FAQ. So one question Is a complaint a case if there's no investigation? For example, you have a complainant who left a message, gave you a complaint, but said they wanted your help in that message. By the time you call them back, they've addressed their issue. Is this a case or possibly INA if information is provided? Good question. So to have a case, you have to have a complaint. To have a complaint, you have to have a complainant. So that would be the person that called you and they did share a concern. And they gave consent, at least on that message, asking for help. However, you didn't take any action on that complaint. So for example, if my mom called in a complaint about my grandmother's care at this facility, left that message for you, just because my mom's calling, you would still need to check with the resident, my grandmother, to see if she shared that concern. So in that scenario that you described, you haven't even had a chance to do that. You haven't taken any action on the case yet. So yes, if you call that person back, they've already addressed their issue and you say, oh, well, how did it go? What did you do? How'd you address it? And they share that information and you maybe provide some information on, okay, next time if this happens, consider this. And there's a regulation about XYZ. And if you have any other concerns, call me back. Then yes, that would be sharing information. That would be documented as an instance of INA because you didn't have chance to take any action on the situation. Bev, thumbs up or anything to add to that? Or thumbs down?
Every situation's different. That sounds fine. With the information that you provided, Amity, and kind of the blanks that you filled in, if there are different blanks filled in, it could be withdrawn, no action needed. So it just kind of depends on your conversation, how in-depth it is, what the problem is, and so on. What you know about the facility, that sort of thing.
Yeah. So I also want to caveat that we do our best at the Resource Center to address the questions as simply and clearly as possible, but there's always going to be what ifs to every single thing that we put out. So for the NORS course training, for the definitions, for the quizzes and the quiz answers, please just read it as it says on the screen and answer the question that's on the screen or in the document. And don't add any what ifs to complicate it because it's there. We did that intentionally. We try to make it as clear as possible because also keep in mind that people that are usually taking NORS training, obviously for the first time, are going to be relatively new to the program. So we need to keep it as simple as possible and not do the what ifs. The what ifs, as these situations get more complicated, that's when the state ombudsman or the managing local ombudsman or whoever the supervisor is helps navigate through those what ifs based on the NORS definitions, codes, etc. And if you can't do that, that's when you reach out to us or to Bev and we'll help you kind of navigate it. But just try to keep it as clean as possible. And I know it's hard because that's what makes y'all great advocates is you ask hard questions and you think outside the box. But just take it as it is sometimes. Okay. Question, do you count the visit and then separately the activities you do during the visit? So you might have multiple activities during each visit. Are there requirements to distinguish how many activities to input during the visit? Good question. The simple answer is document the visit and then document all the activities you do during the visit. There's no minimum or maximum number of activities you can do during a visit or should document. The only thing that you shouldn't do is duplicate documentation. So for example, if Katie and I visited a facility at the same time, then we'd have to sort out what gets documented because if I'm documenting everything we did and Katie's documenting everything we did, there could be duplication. So yes, you will be oftentimes entering in multiple activities, and depending on your state data system, we apologize in advance. It may mean you have to go into different fields and go on different screens, and it could take an extra step or two, but it's really important to capture everything you do. So, there's a question in the chat that kind of flows in with the question in the Q&A box. The question in the chat was, there's often several residents that have concerns or complaints. They share those complaints with me. When I ask them if they want to file a complaint, they say no. So I document it as INA. And that process is correct. So again, this is kind of where we tease out NOR's requirements versus program practice and advocacy, okay? So that process is right. Someone could have a concern. Once you share information, they say, I don't want your help right now. I'm going to resolve it on my own, or I'll talk to my daughter, see if she can help me, but I don't want ombudsman help right now. Or I just don't want to address it right now for whatever reason. Then yes, that what you did in that moment would be documented as an instance of INA. However, as ombudsman best practice, I would encourage you to think about, how are you asking them? Are you asking them, do you want to file a complaint? And if so, if I was a resident, I'd be like, whoa, that sounds way too official. I don't want to file a complaint anywhere. No. But if you ask me, do you want my help with that? Because this is what I can do. You and I can work together, or I can share your concerns with XYZ. These are your options. Here are your rights. Here's different ways we could approach this. If it's a general complaint that impacts more than just that resident, it could even be anonymous. You know, there are different ways that as an ombudsman, you navigate that complaint approach and work out a strategy with that resident. So just kind of think about how you're asking, because I think that makes a big difference as to whether they want to take action. And then if they don't want to take action, even if you ask them the way that seems to work with most residents, that's also fine. Document it as INA and then follow up with that resident next time you visit. See how they're doing, see if they still have that concern, see if they feel like addressing it then, or maybe bringing it up with the resident council. You know, there's all these different ways. And again, as an experienced ombudsman, you'll learn those ways as you spend more time in the field. So, and a question that was in the Q&A said, I'm uncomfortable with the decision tree section that says an ombudsman should not start a case if a resident has a problem but doesn't want you to do anything about it. It's a gray area. Can the ombudsman investigate without really revealing identity? Then I would open a case. So for example, a resident has mold in their bathroom, or an activity calendar doesn't meet their needs. Why wouldn't we open a case and try to resolve it without revealing identity? It could be withdrawn, but we're not capturing complaints about a facility or capturing data for trend reports if we let the resident decide if and when we open complaints. Well, as an ombudsman program, you're resident driven. And I understand your concerns, so that's kind of why I lumped the question from the chat and the question from the Q&A box together, that your process is correct. You need resident consent to share their identity and work a case. If it's something that you can observe, maybe the mold isn't in the resident's bathroom, maybe the mold is in the hallway. So that's something observable by you and anyone else that walks by. Then that complaint could be an ombudsman. You could be the complainant and you could address that on behalf of residents in general. But for the decision tree and for your process, we're just following the complaint process, and that you need to get resident consent before moving forward. So yes, there are those what ifs. There are those instances where you could open the case as the complainant, but it really depends on what that complaint is, and that there's no way for any backlash to that one resident that doesn't want you to pursue anything. Bev, Maria, feel free to add if you have anything. And I'm sorry, I'm dealing with some allergies. Okay. Let me see. Does work with food committees count as a resident council activity? I would need more information on that. My first questions to you would be, who established the food committee? Is that a committee that's part of the resident council? Or was the food committee established by the nursing home or a residential care community, and residents are included on that committee? So to me, I think that's the difference. But Bev, let me know, or Maria, if you have any ideas. I'm glad to see that there are food committees. I know that's a practice we've encouraged.
Yeah, agreed.
All right. Okay, so Bev, I'm going to toss this one to you only because the modification is so new and we haven't really dug into community education a lot. Would providing a written copy of the new assisted living regulations to the Commission on Aging or AAA leadership count as community education?
I don't believe so. I think it would probably be information and assistance. I went back and looked at the definition, and I've got too many things open now, so let's see, let me look for it. Real quick. Give me a second.
I can read it if you want. I pulled it up
Yeah,
for the
yeah,
sake of
read
the
the definition. I think if you read those words, it'll be clear.
So the definition is the total number of instances of community education outreach sessions by the Ombudsman program.
Outreach.
And the reporting tips say you can use for attendance at health fairs, community events, presentations, etc. Yes, I'd agree with you, Bev. And I feel like that's internal communications. That's not community education. Community education are those stakeholders, are the people that you're trying to reach, the family members, future residents.
Yeah, another thing could be, it's could be systems advocacy kind of activity, depending on, what you're saying about it. If you're trying to influence or saying this is a good thing, it's a bad thing, and this is why. It depends on who you're talking to, but yeah, it's probably information and assistance based on the question that you're asking.
Thank you. All right, so we got a little bit. Thank you so much, Michael, for putting more info about the food committee. The food committee was established by the residents. And the food committee is needed due to time where food issues are dominating the resident council. Excellent. Yeah, that's great. Mainly it's out of necessity, but with the full support of the resident council president. Then yeah, in that case, I would count that.
Yeah, I would too, especially with the changes in the NORS tables where we talk about resident groups.
Yep. Agreed. Thank you. Maria, did you want to add something?
Yes, there's a follow-up question in the chat, Amity, that's asking about the decision tree, and could we include some more of those? Could we include some what ifs? Personally, if any of you have ever done genealogy research and you have blended families and you have stepchildren and step parents, and it just becomes way too complicated. So the idea of a basic decision tree is just the very basic pieces, and then have facilitated discussion about the possible what ifs. It would be not impossible, but probably not as helpful to the learner to do a lot of what ifs in a decision tree. That's my thought. Bev, Amity.
Yeah, I agree. It's a tool. And if there is more to be discussed or you have questions, then you should always just go to your state ombudsman or whoever does training.
Yeah, agreed. And again, this is kind of what I was trying to get across with the slide about NORS requirements versus state practices. The decision trees are more about how you document what happened, but it's according to the rule. So you always have to get resident direction, et cetera. But that's about NORS requirements, not about ombudsman practice. The initial certification training goes in depth about the process when you receive a complaint, how to, respond. So that combined with the NORS training should make more sense and not necessitate all the what ifs, because that would just be too cumbersome and get away from the point of a simple tool. But thanks for the comment. I will say though, if you have specific what if questions, or if you have requests for different decision trees to cover different documentation issues, submit those to us. And I actually will cover that near the end of the presentation for some opportunities for more input from you all. Okay, does verbal or written resident consent need to be documented when providing information to a resident in an activity? So I want to make sure, please, anonymous attendee, respond if I did not address this properly, but verbal or written consent is only needed when you're acting on a complaint. And how I read this is when you're saying providing information to a resident in an activity. So to me, that means you're just sharing information. So no, you don't need consent. You wouldn't even document, at least for NORS. They're just counting the instances of INA provided. So hopefully that answers your question. Okay, could you give me a few examples of media that would count towards community education? Thoughts on that, Bev?
I wondered if that was regarding the change, allowing newsletters and other forms of media that impart information. And it's things like, well, I'm trying to think other forms of media. We talked about social media. So, well, we already addressed online things. So like if you did a Facebook
A
Live or
newsletter.
a Facebook Q&A or something like that. I'm sorry, Maria, what did you say?
Didn't mean to overspeak. I was thinking of a newsletter. I think Daniel over in the chat section mentioned a newsletter, other forms of media.
Yeah, that's
social
what,
media certainly became very popular during COVID and the pandemic, and a lot of the programs did start doing more outreach through social media.
yeah. Yeah, we were just, with the change, we were just specific to say that because we previously didn't allow it. So the change allows it, but we were specific to say that it needs to be something that imparts information about long-term care or the ombudsman program.
And I do want to add too, for the reporting tips, if the education is web-based or on-demand, so like an on-demand course, the program must have a way to count the number of individuals who complete that session in order to count it as community education. So I see that Michelle Carter said they participated in a podcast. So if you participate in a podcast, and Bev, please correct me if I'm mistaken, what I would do is ask the host for information to show the numbers of people that downloaded it, listened to it, those analytics to prove that at least one person listened. And then I would count that as community education, especially with how often people listen to podcasts. But I think that's a good example. Okay. So count the numbers. You you are not counting the numbers of people that media contacted, or you're not counting the number of people on your listserv for your newsletter. That information is not for NORS. It just needs to verify, you just need to have a way to count the people that received that information, listened to that information, participated, just to basically prove that your community education reached a person. But you don't have to, at least for NORS, you may have to for your state, but again, that's a state specific requirement. So at times I get a complaint from outside my area, so region I serve. So I look up the ombudsman office that provides services for that person's area and provide that information to them. That is INA, correct? Correct. That is definitely a great example of information and assistance. Yes. Okay. What if they say I haven't addressed it with anyone? So what if a resident says I haven't addressed it with anyone at the facility, but say, can you ask the DON to come down and talk with me? I do ask the staff to go see them. I would leave my contact information to contact me if it doesn't get resolved, then to reach out. So asking if that is complaint or INA.
I believe that's a complaint. It's an expression of dissatisfaction. It required you to take some action. I would make it a complaint.
And then you'd need to follow up with the resident to see
Right.
if that situation was just resolved or if you need to provide more assistance. And I would even ask, I mean, I'm sure you probably do this, whoever asked this question. I would ask in that situation, would you like me to stay with you as you talk to the director of nursing? I don't have to say anything. I can just be here to provide support. It just depends on the comfort level of the individual. Great. Okay, so I'm going to stop that there. It looks like we covered most of the questions. And for those that we didn't, we will keep the questions. Libby or Katie, I know you're copying the chat. We will have the questions because we are going to have a virtual office hour later this month, last Wednesday of this month from 2 to 3 Eastern time. And we're going to use that entire time to talk more about NORS. Because we figure once we launch these materials, you take a look at it, you may have some more questions at that time. So please register and join us for the virtual office hour, and we can respond to more of your questions. Some questions I'm going to ask during that virtual office hour, and if you have a response now and want to drop it in the chat or email me, you can do that as well. Now that we have the NORS online course, we were wondering if you're going to use the NORS training materials. So the PDF versions that we have of the basic principles, the quizzes, and the quiz with answer sheets. If so, would you like fillable PDFs for the quizzes? Because we're trying to imagine if you do this in person with your trainees, then you would need a fillable PDF because you're printing it, they're answering it on site. Is this something you email your attendees and they could use a fillable PDF, and that would be easier for them to submit the answers to the quizzes? So that's one question I have for you. The other one is, if you're still going to use those materials, do you want us to also provide revised PowerPoints? We did not do that automatically because we figured now that we have the online course, more people may be using that. But I want to hear from you all that do the training in the field if you find that helpful. The other question, as I mentioned earlier, if we made more decision trees or made any other type of material. So think of something that would be helpful to you. We already have FAQs. Would it be helpful to provide more decision trees or some other type of material? And if so, what topic do you want to address? So please mull over those questions. I will ask them again during the office hour. You can email me here. And if you have questions about NORS documentations and requests for TA or training, I do want to say that too. NORC, we obviously provide these webinars. We provide, but we also provide training for states, both in person or by webinar, or even we've sat and just had discussions. So with the state ombudsman and maybe their state staff or their trainers about teasing out some of these what ifs with NORS. So reach out to us if you want that. And then if you have questions about the platform, please connect with Katie. It's pointless asking me anything about the platform. So please direct those to Katie. She's the expert. So with that, and I see questions coming through and certificates. If you do the online course, you'll get those certificates for each part of the course that you take. But we don't have certificates for the PDF versions of the training. So please keep dropping in those ideas. Let us know how we can help you. Connect with us. Here's all our information. But for now, I just want to say thank you for joining us. Thanks for your excellent questions. Thank you, Bev, for your comments and for your support and for funding this project. Thanks, Maria, for your work leading this. And of course, thank you, Katie, for working on the online course, and to Libby for the background on the webinar. So thank you all. Have a great day. Continue your great work.
Bye, everybody.
Bye.